Welcome everyone, I'm Laura Brown. I'm one of the senior trauma surgeons here at St. Francis Medical Center and the program director of the general surgery residency.
Hi, my name is Titus Ho. I'm a PGY3 resident.
Hi, I'm Melissa Nathan. I'm a second year general surgery resident.
On a typical day, our residents will spend the morning rounding on our patients, on our inpatients, and then prepare for a day of operating in one of our services. Those services include a general elective, vascular elective practice, as well as our surgical oncology, which includes HPV, surgical oncology, colorectal surgery, and some of our thoracic colleagues as well. They have exposure to other specialties such as endocrine surgery, transplant surgery, and then on the emergency surgical services, they round and take care of critically injured patients on the trauma and critical care service, manage patients in the ICU, and lastly, cover our emergency general surgery service.
The best part of the program is how early they get us into the operating room. That was something else that I found incredibly important for my training. I'm someone that's interested in going straight into practice right after residency, so I wanted to get into the operating room as soon as I possibly could. And I've been able to log a whole lot of cases just finishing up my intern year into my second year.
For me, the best part of the program is the early operative experience as well as the high surgical volume. So for me, wanting to become a surgeon, I knew I needed a lot of cases and I wanted to get lots of hands-on exposure to a variety of different things, and here in Peoria we're able to gain that breadth as well as the depth of education in the ORs.
This program is kind of the best of both worlds with big kind of university trauma cases and tertiary care cases, as well as a lot of rural cases as well. And so we're able to kind of train with both views in mind, which I think is very important.
One of the best parts of our program here in Central Illinois is that we actually have a very large catchment of patients that come from all over Central Illinois. Our 16 hospital system, as well as other referring centers around the area, send us very high acuity patients. So our residents are exposed to some of the most complex pathology in the area.
Acute care surgery service line here is one of the busiest in the nation. I think we're in above the 80th percentile in terms of surgical volume. So we'll get the run-of-the-mill appendicitis or cholecystitis cases. We'll also get patients that have not followed with a healthcare provider in many years and come with advanced obstructing colon cancers or advanced pathologies of a variety of cases.
What we try to do here is prepare you not just for success in residency, but for success in the rest of your career. Whether that career is focused as a rural general surgeon, supporting our surrounding communities, and being able to handle those emergencies that you can at the facility with the resources that you have, or by transferring those patients to us and to specialists here at the main hospital, folks who are fellowship trained and experts in a specific type of surgery. We are one of the very few programs in the country that train both types of surgeons.
I think the most important thing from a surgery resident standpoint is operative exposure, as well as the camaraderie that people have at their program. So if you have happy residents like we have here, I think you'll have a good opportunity of training, and you'll have a balanced educational experience.
Most importantly, residents need to come to this program with a growth mindset. You will not do everything right the first time. That's part of residency. It's really important to find ways to come back the next day and do it better, to figure out how to learn something if you don't know it today, to say, but I will learn it by tomorrow. And that's one of the most important things that our faculty ask for. So Peoria is a hidden gem in the middle of the Midwest.
It's a very beautiful city. It's located right along a riverfront, so there's a lot of restaurants and things to do in downtown on the riverfront. There's also a farmer's market that I try to catch anytime I can in the summer. And then there's a variety of restaurants. Any kind of cuisine that you really want, you can find in Peoria.
For me, it's the availability of good restaurants, and as well as proximity to family and friends. Coming from Chicago, it's not a bad drive to go up when I have time off near an airport, so I can fly to places if I need to.
If you have family, we strongly recommend that residents with family and a family focus consider our program, because this is a great place to raise children, but also because it's a welcoming environment for those residents who are looking for a community, a sense of community, and a place to practice.